Great. So today we're here with Dr. Jason Heckman. In November is Pancreatic Cancer Awareness Month, and Dr. Heckman is going to tell us a little bit about pancreatic cancer and how we can recognize early signs and symptoms of the disease. So Dr. Heckman, thank you so much for being here with us this morning. Can you start off by telling us what and where is a pancreas?
So a pancreas, well, thank you for having me here, of course, and I would tell you, first start by saying a pancreas is an organ that is shrouded in a lot of mystery. It goes back millennia, and it's an organ that goes across our bodies like this. It's in the back of our abdominal cavity. And the pancreas is very interesting because it has many functions. It functions as a endocrine organ and also as an exocrine organ, which means that it helps with digestion, and it also helps with things like everyone knows, making insulin.
So sometimes our pancreases are not healthy. So can you tell us a little bit about how common pancreatic cancer is in the United States?
So pancreatic cancer is actually a relatively uncommon cancer. There's maybe over 50,000 cases of pancreatic cancer a year in this country. If you compare that to other types of cancers, it's relatively uncommon.
And what are some signs and symptoms of pancreatic cancer?
So the signs and symptoms can be sometimes quite nebulous. They often will kind of sneak up on people, so to speak. The most obvious sign is when the cancer would be in the head of the pancreas, which is near the bile ducts. The bile ducts connect the liver to the intestine. If the bile ducts get blocked, then patients will have jaundice, or they will turn yellow, which is a pretty obvious sign that there's a problem. If it's in the tail of the pancreas, which is not near the bile ducts, the patient will have more kind of slow, not very noticeable symptoms, maybe weight loss, and ultimately may have abdominal pain. Sometimes there's no symptoms at all, and we might find it incidentally, meaning that someone gets a scan for something else and they have a spot in their pancreas. So it's sometimes a difficult diagnosis to make until it's very obvious.
Are there any factors that may increase an individual's risk for pancreatic cancer?
So we don't know any definite cause and effect relationship with pancreatic cancer like we do with other cancers. There are things that are linked to pancreatic cancer, such as smoking and patients who are overweight or obese are probably the two most highly linked to pancreatic cancer. And then there are also certain other conditions that can lead to pancreatic cancer, such as genetic cancer conditions, or if such as a family history of pancreatic cancer, and but there's no real known cause and effect relationship between anything.
So then, that being the case, how is pancreatic cancer diagnosed?
So usually we're going to diagnose it based on non-invasive imaging, such as a CAT scan or an MRI scan. That's usually the first step if the doctor were to suspect a problem with the pancreas. And once the non-invasive imaging is done, then we're usually going to be looking at having a patient get what's called an endoscopic ultrasound or an ERCP test. Those are tests done by the GI doctors. An endoscopic ultrasound is just that, where they go down into the stomach and the scope has an ultrasound on it, and we can look at the pancreas and we can actually get a biopsy.
Wow.
And then an ERCP, which the acronym just mean, for all intents and purposes, means that the GI doctor goes down and they can put a stent into the blockage of the bile duct.
Really?
And we can also get a biopsy that way. So that's the most common pathway to diagnosis.
If someone unfortunately is diagnosed with pancreatic cancer, can you tell us a little bit about the different treatment options?
Sure. So, in the past few years, we've had a few helpful things with pancreatic cancer. The first thing is, as I was talking about with the diagnosis, we can start thinking about doing things a little bit differently than we used to in the past. In the past, we might diagnose it, take the patient right to surgery. Nowadays, we start thinking a lot about doing treatment before surgery. And those kind of treatments are usually chemotherapy, sometimes even radiation. Ultimately, though, the treatment for pancreatic cancer is to go ahead and remove the diseased part of the pancreas where the cancer is, and that in combination with chemotherapy gives patients the best chance of long-term survivorship. The unfortunate thing about pancreatic cancer is that often we diagnose it when it's already advanced, or meaning it's spread outside of the pancreas. So we're always looking for ways of diagnosing it earlier, but as I said before, it's very difficult to diagnose pancreatic cancer in the early stages.
You mentioned surgery. Can you tell us a little bit about whether or not that is open surgery or laparoscopic surgery?
So the difference there is the incision with open surgery is the traditional bigger incision, which is the tried and true standard way of doing the pancreas surgery. The second option that we have is minimally invasive surgery, such as laparoscopic or robotic surgery. We do both of those, or all of those techniques here, and especially robotic surgery, we found that to be taking these complex, big operations and making them into a minimally invasive surgery has been a real benefit to patients. And we love taking care of patients like this, complex patients, and we like to try to figure out the best ways of doing things to get patients better quicker and get them through their surgeries.
Outstanding. So someone going into pancreatic cancer, removal surgery, or any surgery really, what kind of questions should they be asking their doctor and their surgeon?
So one of the most important things is knowing, educating yourself about the disease, and you should definitely be asking certainly your surgeon, how many surgeries that they do, because the more surgeries that you do, generally the better the outcome is. So that's number one paramount thing to discuss. Second thing is this being discussed in a multidisciplinary fashion, meaning are you seeing an oncologist as well as the surgeon, maybe even a radiation oncologist, and all those people working together to come up with the best plan for each individual patient. And also, once you get into the smaller details, you're going to want to know does the surgeon have all the capabilities at his disposal to take care of any complications that happen after surgery. You're going to want to know, one of the most important things that we talk about with patients is your diet and everything after surgery, which is very different than it is before someone gets pancreatic surgery. So there's a multitude of things that are very important to talk about. And again, going back to volume, meaning number of surgeries that the doctor does, is very important too for the conduct of the operation.
If someone watching live or down the road has any questions or concerns about their pancreas, pancreatic health, pancreatic cancer, who should they ask?
So first thing is, certainly talk to their primary care provider. The internet certainly is a good resource at first, but you have to be careful with the source of what you're reading, what you're looking at on the internet, and then obviously, talking to someone such as myself or at our center here can always be amazingly helpful. Like I said, we love taking care of patients like this. This is what we dedicate ourselves to.
Dr. Heckman, thank you so much for being with us here today.
Thank you.